All right, good morning, everybody. Got a lot of papers to sprinkle out here today, so a lot to talk about today. Thanks for joining us for COVID update today. Really, we're going to spend a lot of time today talking about one of the larger issues we have in our city right now. We have obviously what we're calling or has been identified as a hotspot at Smithfield Foods. And really, we have only found out about the heat of this hotspot in the last 48 to 72 hours. That's something, to me, that's been a good reminder of how quickly this virus can spread and does spread and the contagiousness of it. And it really reinforces the messaging we have been saying all along. And so the case growth at Smithfield has been very large. And I just got off a call, about a half-hour call with the CEO of Smithfield, as well as the local plant manager at Smithfield, to understand the mitigation efforts and the strategies that they're undertaking there. I got to be honest, I went to the call pretty fired up, wanted to get a better idea of how they were handling this outbreak. I feel a lot better after the call. Some of the key points of that call is that Smithfield is losing money operating this plant right now. They have been told by the federal government to stay open and continue to run. In fact, the CEO had to leave the call with me because the Department of Agriculture Secretary Sonny Perdue was on the line, and he had to drop me to take that call to continue to talk about the importance of them staying open. Why is that important? There is a whole continuity of our food supply that's really important, and we're not talking about a lot right now. But all you have to do is go to a grocery store or go to a meat counter and see the limited supply in front of you to understand that there's a reason why our meat packing, agricultural processing facilities are critical infrastructure, and they are being told by the federal government, please stay open. Ken's point to me was, the easiest thing for me to do right now would be to close the plant. That'd be the easiest thing to do. We're staying open because of the continuity of the food supply, which we're being asked to continue and not disrupt right now. They have decided to do a 3-day closure from April 11 to 13, a paid 3-day closure. They just announced that about a half hour ago maybe. What that will do is allow Smithfield to retool some of their line setups and so forth to ensure proper social distancing and proper procedures within their plant, many of which they've already been adhering to. Our Department of Health is actually over at Smithfield as we speak, doing kind of an inspection and talking with their leadership on the strategies that they're doing right now internally, both pre-shift, on-shift, and post-shift. And so what we're finding, though, and this is a big challenge we have in our community, is I believe, for good reason, that the spread we've seen at Smithfield is not necessarily happening at the plant itself. It's happening when people leave the plant and go home. So we have communication issues we have to continue to work on, and mitigation issues that need to happen within the homes of those employees. I think of particular importance is going to be our Hispanic and our Nepali communities. Those are two of the largest immigrant populations we have in our city, and they're being hit the hardest with the outbreak at Smithfield. So we're already working on some targeted communication strategies with those two populations specifically. I did a Facebook Live about a week and a half ago with two Nepali leaders. It's got more views than any other Facebook Live I've done during this whole outbreak, and they get a lot of views. And it's getting shared and reshared. They're hungry for information, and we're taking our commitment seriously to better educate those communities on the right social distancing practices they need to take at home. You know, the State Department of Health plays the lead role in the contact tracing, it's called, as well as the quarantine and isolation efforts in that. So we just had a call with the State Department of Health this morning. So we're taking our cues from them on the contact tracing and the isolation of those folks. We're working alongside them, providing them the resources they may need. Let's see, we also talked a little bit with Smithfield just about the vulnerable populations that are in their plant. They have 119 employees that are over the age of 65, that they all of a sudden take that hit to their workforce. And now I want to be clear that right now, the proper approach is not to simply say we need to shut down the entire plant for many of the reasons that Ken Sullivan stated, but also there are a lot of housing and income challenges that would create in our community right now. So the best approach we can take is an approach where we're working hand in glove with Smithfield, with the State Department of Health, with their health insurance provider, Avera Health, and you're going to hear from Mike Elliott in a second here about what Avera is doing on that also. And so know that we're taking the Smithfield situation extremely, extremely seriously. Now, I will say a piece of good news is that you look at the growth of cases in our community over the last few days, and if you could just remove the Smithfield outbreak, we've seen pretty minimal growth in Minnehaha and Lincoln County. So that's encouraging, okay? That tells me the social distancing, the impact of some of the executive orders, the regulations that we've put into place are working. Now is not the time to let up on those because say, oh, attaboy, we've done a good job, I'm going to kind of take my foot off the gas. It's the opposite. Now is the time when we really got to buckle in and stick to those even more. So, you know, in closing, before I turn it over to these guys, I want to say two other things. You know, if it's not clear, the rate at which this virus spreads is really intense. And we've seen it before in other cities and communities. Now we've seen the intensity of that growth and what that can look like in Sioux Falls. So our top priority continues to be public health and minimizing the spread of this virus. That's why we're taking the work we're doing with Smithfield and the conversations we're having with them very, very seriously. I'll be honest, that was a very heated call we just had for the last half hour. They're mad. I'm mad. It's tense. They're being told by the feds to stay open. I'm being told I need to protect this city, so we're working together. Tension is good. It's a good tension. It's a healthy tension, but there's certainly tension. And I think tension leads to progress. And so I want the community to know we're working really hard with that employer. So for businesses, please take this call to action that we're making to Smithfield as well, which is we can't emphasize enough the importance of your businesses taking the right precautions now so that you don't get to a point where you have 10, 20, 40 to 80 cases over the course of a couple days. I still, today, April 9, am still hearing of businesses that are operating like they've always operated. It's not here, it's not in my business. Go talk to Mark Wiggs, the plant manager at Smithfield, and ask where he was a week ago and where he is today. And so you need to be implementing good, smart business practices now. And if you're not, if you're an employee and you don't feel your employer is providing a safe working environment, you need to talk to your employer. Don't talk to me. Don't come to the mayor. You need to go to your employer and say, listen, watch the mayor's press conference. He's speaking right to you. You need to do that. So please take that seriously, businesses, business owners. You have a responsibility, not just to your employees, but all the hundreds of contacts your employees then have once they leave your facility. So proud to have Mike Wilde and Mike Elliott with Sanford Health and Avera Health here with us today. I'm going to turn the floor over to them to give some updates that they've seen from the healthcare side of things. So I'll start with Mike Wilde from Sanford Health.
Thank you, Mayor, and thanks for your continued leadership and continuing to have us function as part of the city command as well. At Sanford Health, our teams continue to prepare for the spread of COVID-19 and the patient surge, which we anticipate in the next few weeks. We know many are anxious about the impact of the surge on our community and the healthcare resources, and we are doing everything on a daily basis, irregardless of the day, to prepare for this surge. We've been working with local, state, federal partners and our data experts to provide the most accurate projections for the timing and the size of the patient surge. Our community surge plan focuses on personal protective equipment, supply readiness, bed capacity, ventilator capacity, and staffing. We're working hard with our teams to ensure we can continue to provide exceptional care to our patients at every stage of this surge. From a testing standpoint, I'm pleased to share that Sanford last week launched a new rapid coronavirus test. This is another significant step in our community and our response to this virus. It enables us to deliver results within 90 minutes. That 90-minute test is being used for those most in need, so our highest priority patients in the hospital, along with our healthcare workers and elderly or vulnerable population in long-term care facilities, and patients with issues such as immunosuppression. Also, patients in our procedural areas for theirs and our staff's protection. Just this week, our lab surpassed 5,000 coronavirus tests, and we expect to hit 10,000 in the next couple of weeks. This level of testing enables us to deliver responsive, high-quality care to our patients and provides an accurate view of the progression of the virus in our community. In regard to safety measures, this has been a rapidly evolving science, even in the last week. At Sanford, we began masking our forward-facing or patient-facing employees, caregivers, and did that in the last week. That was based on rapid science, which a couple of weeks ago we probably were not supportive of, nor was the Centers for Disease Control, and have responded to that rather quickly for the protection of our staff in addition to our patients. We've also started temperature monitoring as of yesterday, our employees as they enter the facility, in addition to screening for symptoms. This was supported by the Centers for Disease Control last night as well, and again for the protection of our staff and protection of our patients. These comprehensive actions will help our community, keep our community safer, which is our top priority, your health. Every day, our community is coming together to strengthen our response to this rapidly changing situation. Very humbling stories that occur on a daily basis of the community coming together. There are students right now that are participating in online learning, things that they never thought they would do, things that teachers never thought they would have to do, and they're holding down the fort at home while healthcare workers, first responders, service industries, vital industries are continuing to do their job. So they're doing a great job. Certainly need to continue to be patient. This will pass, and thank you.
Good morning. Mike Elliott with Vera McKinnon Hospital. This has been an interesting couple of weeks, hasn't it? It would be easy to be getting tired of this. It would be easy of getting tired of seeing me on the news. Completely understand that. Mayor Paul had a great statement. Now is not a time for us to take our foot off the gas pedal. Now is absolutely the time for us to say, let's continue social distancing. Let's continue good hand hygiene. Let's continue to quarantine if we're having any symptoms. These measures have, as the mayor said, these measures have had an impact, and they will continue to have an impact. Without these measures, the models are very clear that our health systems could be easily overrun. We won't have enough beds, we won't have enough physicians and nurses and equipment to take care of all the people that need them. So it is vitally important that all of us continue to do everything we can to flatten the curve to mitigate the spread of this disease. Avera, I want you to know, is 100% supportive of the mitigation strategies that have been put into place so far. We think they're just absolutely essential. While we are focusing heavily on mitigation strategies, those of us at Avera are also day and night planning for the worst of a potential surge. We are doing everything we can to maximize our people, our beds, our equipment, our supplies, so that we can, as we always have, be dedicated to taking care of people in this region. We are anticipating seeing a larger volume of patients in our hospital than we have ever seen before. And how do you possibly prepare for that? I guarantee you it is, the planning is going on day and night. As a matter of fact, a little bit later today, we will have a formal press release announcing some of our plans regarding surge capacity. We are going to convert our Prairie Center, a 5-story building on the main campus of our hospital, into a 150-bed hospital. That is not the extent of, but it is an example of the surge planning that we are undertaking. Patients that typically receive care in the Prairie Center will be notified of any changes in the location of their clinic sites as we go forward. But I just want you to know that although all of us are hoping and praying for the absolute best here, as a healthcare system, we can't afford to do that. We have to be absolutely prepared for the worst. Very humble, very proud to be a part of the city EOC, to work with the mayor, the state officials, our partners at Sanford Health. It is, even though we're practicing our social distancing, it is nice to see us as a community and as a state come together in the way that we have to try to protect all the people in our region. With that, I'll turn it back over to the mayor. Thanks, everyone.
All right, any questions this morning for myself or either of the mics?
Yes, sir. What do you say to residents who are concerned that the 3-day shutdown of Smithfield?
The question is, what do I say to residents who feel that the 3-day shutdown at Smithfield is not enough? Say a couple things. One is, based on the call I just had, people need to know this company's taking this really seriously. All right, so the 3-day shutdown, which is also paid, by the way, is needed right now to give their employees a pause and to give Smithfield a pause to ensure that they're operating the absolute safest environment for their employees right now. I will tell residents this. April's going to be tough. May is going to be tough. There will be other Smithfields that we'll be talking about. There will be other hot spots. And we have to just deal with them as they come. We have to work with the private sector as they come. Our concern all along, and the main thing we're watching, is the capacity of our healthcare providers. So we want to be sure that whatever these organizations are doing, they're doing with the primary goal of flattening the curve so that we don't put a lot of strain on these healthcare systems. I will say to those people who may say it may not be enough, we have to go back to what are critical infrastructure organizations. I don't think people realize, as one of the largest pork producing plants in the country, what shutting down a place like Smithfield does to the food supply chain in this country. And so we also have a responsibility to that, to the federal government, which has issued very clear guidelines on what we as local officials have to do to ensure some continuity in that food chain. And so we take that very seriously.
Can you tell us when the first case was reported at Smithfield, and did they report and contact the city with that?
I can't tell you that. The state handles all that. So again, the State Department of Health has the jurisdiction over the case reporting, the contact tracing, and so forth. So sometimes I think there's maybe a little lack of clarity on, well, whose jurisdiction, quote unquote, is this to respond? We get our information from the State Department of Health on where they see cases, when they see cases. I can't give you an exact date of when we heard about the first case because they don't tell us. We have 300 and some cases in the state. I don't know where all those people work, what they do. What they will tell us is after they start seeing a trend, they say, hey, we got a hot spot brewing in Smithfield, and really the last 72 hours is really when we found out that we have some challenges we got to work with there.
Just in case if the 3 days is successful and they go back to work, what happens if it starts to spike again? Will it just kind of go in spurts?
Well, I made it clear on the end of my call. I said, listen, 3 days is good. If this doesn't calm and we don't see some changes happening here, there's probably going to be a call from me to take more drastic measures at that specific place. Now, again, I think they're doing all they can. The challenge is when those 3,500 employees leave out of there and they go back to their apartments, their houses, what are they doing at home? Because that's where, in my opinion, I think the spread is occurring. One of the safest places you could probably be is within some of these organizations that are doing enhanced cleaning and hand washing and sanitizing and temperature checks, and they're doing so much right now. It's when those employees leave, and that's why the communication to those immigrant communities. Again, we talk about Hispanic and the Nepalese, but there's 80-some languages, I think, spoken within Smithfield. There's a ton. So the communication challenges are great, and that's why now that we know where the primary cases are coming in terms of the language spoken, it's going to help us do a better job of identifying and educating those folks.
And what about the people concerned with the food coming out of Smithfield being contaminated?
Question is the food coming out of Smithfield being contaminated. Virus will not travel with food. So you can feel safe to eat Smithfield food, to eat Smithfield pork, to eat meat, period. Unless you're vegan, vegetarian, eat meat, it's fine. Shouldn't be a concern about that.
I don't know who would best answer this question, but Governor Nome announced recently about a 100-bed facility coming to this area with the help of the National Guard. What update can you possibly provide from that perspective, and how the healthcare systems are working together to get ready for that?
I'll let Dr. Wilde speak to that. The question was about the 100-bed kind of surge capacity or quarantine facilities that we may set up with the help of the National Guard that the governor announced, and I know Dr. Wilde's been in a lot of those conversations.
Thank you, and thanks for summarizing the question. We are working very close, as I said in my statement, as Dr. Elliott said as well, we're working very close with all levels of governance, including the state. That is in the planning stages right now, with expectation for that to rapidly move to the operational phase as well. Is it going to be 100-bed? Is it going to be bigger, smaller? That's to be determined. We do have a call with the state, with both healthcare facilities tomorrow to get rapidly moving on that. And we've had great cooperation and communication from the state in that regard.
Has a location been decided yet?
That's also being looked at to best provide, because when it comes to a facility like that, what we really need to look at is infrastructure and things that, you know, speaking for myself, it's pretty easy to take for granted, things like laundry, food, cleanliness, things of that nature, in addition to oxygen, and other medical services that are needed. And so how can we best identify a facility in the city to serve all those roles in the most efficient manner to get it up and running as soon as we feel necessary?
Any other questions this morning?
In regards to Smithfield, after the conversation, are you confident that they've learned and are still learning, and you're learning, and what we can do better for the future Smithfield that you said may be coming up?
Yeah, the question was, after the conversation with Smithfield this morning, do we feel that feel comfortable with their response and that they're learning about this as we are? You know, I think the interesting part of this is you can't look back and say, okay, how do we respond back in '94 when this happened? And what do we do in 2002 when this happened? This hasn't happened. This hasn't happened to a Smithfield. This hasn't happened to a city, at least for 100 years. So a lot of the playbook's being written as we go. So these businesses are having to respond as we go. Look how many businesses have employees that are working from home who have said for years, no way will we allow our employees to work from home. In the course of 10 days, they had to figure it out, and now they're doing it. So businesses are having to be so nimble and change their operations and practices so quickly as a response. Based on the call I had with Smithfield, I feel very comfortable and confident that they're doing absolutely all they can right now. And they're serving two masters, and that's hard. They're serving the federal government and said food supply and the continuity of the food chain is critical right now, probably more than ever before, and so is public safety and public health in mitigating the spread. So they're trying to do this, and they're working hard to do this while ensuring this engine stays running as well. So we're going to keep a close eye on them. We got a good line of communication open with them, as I know the state does as well.
With the possibility of more businesses experiencing, an increase in cases, is the city looking at other limitations or other restrictions going forward to kind of help mitigate that spread further?
Yeah, the question is there other business classifications or things we'll look at to limit businesses from operating to help mitigate the spread? You know, I think where you're seeing spread happening is is like in a place like Smithfield, well, that's considered an essential business by the federal government. And oddly enough, a lot of businesses are considered essential businesses. So there's only so much you can do within a city to limit business activity because there's so many essential businesses that have to keep operating, whether it's banks, whether it's construction industry, whether it's food industry. So what we're doing is we're learning best practices from each other. What Smithfield is doing right now may have to be applied to another business in our city to say, hey, this is how Smithfield handled this, and we'd recommend you take a few pages out of their playbook and look at using that in your organization. Thank you, guys. Appreciate you being here today.